Hello, I'm Dr. Halimatun, Anaesthesiologist from Hospital Pulau Pinang. Today's lecture will be on basic life support for healthcare workers. Now, basic life support for healthcare workers refers to the care by healthcare workers providing to patients who are experiencing cardiac arrest, respiratory arrest, or airway obstruction. As healthcare workers, we are expected to know how to perform cardiopulmonary resuscitation. In this lecture and later the modules, there will be a standardized guidance on the techniques used during the initial resuscitation of a cardiac arrest victim among healthcare workers. It is the mission for Ministry of Health to train the first-line rescuers for us to be able to resuscitate and maintain the collapsed victim until the definite help comes. Now, the contents for this lecture would be the objectives, introduction, anatomy and physiology of cardiopulmonary system, an overview of basic life support, automated external defibrillator, and at the very end of the lecture, there will be a summary. So the objectives for basic life support would be: 1 is to be able to describe the links in the chain of survival. 2, for healthcare workers to understand the relevance of anatomy and physiology of cardiopulmonary system. Next would be to describe, understand, and to be able to perform basic life support. So what does BLS or basic life support includes? It has airway, breathing, circulation, automated external defibrillator, and also the management of choking or foreign body airway obstruction. As you can see, this is the chain of survival. The chain of survival summarizes the vital links needed for successful resuscitation. Most of these links apply to victims of both primary cardiac and asphyxia arrest. The first one would be the early recognition and call for help. So as we know that cardiac arrest occurs in 1/4 to 1/3 of patients with myocardial ischemia within the first hour of onset of chest pain, by recognizing the cardiac origin of chest pain and calling the emergency response services before a victim collapses, this enables rapid activation of emergency response system. When there is cardiac arrest, early recognition is critical to enable rapid activation of the ERS and prompt initiation of bystander CPR. Now, the key observations are unresponsiveness and not breathing normally. For early CPR, early bystander CPR, by initiating the CPR, can increase the survival rate from cardiac arrest. If able, bystanders with CPR training should give chest compressions together with ventilations. Early defibrillation within 3 to 5 minutes of collapse can produce survival rate as high as 50 to 70%. Remember that each minute of delay of fibrillation can reduce the probability of survival to discharge by 10 to 12%. Now take note that the links in this chain work better together when bystander CPR is provided, and also that the decline in survival is more gradual and averages 3 to 4% per minute to delay to defibrillation. And the last would be the early advanced life support and post-resuscitation care. By initiating early advanced life support and post-resuscitation care, this will improve the survival of the victims. Next, we'll talk about the physiology and anatomy of the heart and lungs. So the main components of the heart are heart muscles, which helps to contract to pump the blood, the heart chambers to collect and channel blood flow, the heart valves, which allows only one way of flow of blood, conduction system that helps to coordinate the heart muscle contraction, and the coronary blood vessels that supplies the blood to the heart. Due to this simple way of how the blood flow occurs, when the heart stops pumping during cardiac arrest, effective external chest compressions push out blood from the heart chambers and thus maintain blood flow and oxygen delivery to the heart, brain, and other vital organs. Now let's have a look at the physiology of respiratory system. The human body needs oxygen to sustain life. After about 4 minutes without oxygen, brain cells start dying and can lead to irreversible brain damage and ultimately death. So the main components in the respiratory system are the airways, which is to channel the air to the lungs and blood vessels for gas exchange, muscles for breathing to move air in and out of lungs. Take note that in the in-room air, there's 21% of oxygen, whereas in rescue breathing, it uses exhaled air that contains 16% of the oxygen. I would like to highlight that in most child-related cardiac arrest that occurs, it is due to hypoxic event. Therefore, breathing and oxygenation are important for a successful resuscitation. Let's have a look at what is sudden cardiac arrest. Now, sudden cardiac arrest is a condition in which the heart suddenly and unexpectedly stops beating. So when this happens, blood stops flowing to the brain and other vital organs. And remember, as I've said, sudden cardiac arrest causes death if it's not treated within minutes. What are the signs and symptoms of cardiac arrest? Whenever there's unresponsiveness, not breathing, or there's abnormal breathing or agonal breathing, and remember that seizure can also be signs and symptoms of cardiac arrest. Now let's have a look at the basic life support overview. Remember that in hospital, the resuscitation starts with the collapse of sick patient, and we would shout for help and assess the patient whether the patient have signs of life. If there is sign of life, we will assess the airway, breathing, circulation, and follow the recognized and treat accordingly with oxygen, IV access, and monitoring. Subsequently, we will call the resuscitation team whenever appropriate and hand over to the resuscitation team. What about if there's no signs of life? Again, we will call resuscitation team because it is imperative to call for help, initiate early CPR with a 30 chest compressions over 2 ventilations with oxygen and airway adjuncts. Apply pads and monitor whenever available and attempt defibrillation if appropriate. Next, advanced life support will commence when resuscitation team arrives. This is the adult basic life support algorithm for healthcare providers in Ministry of Health hospitals and healthcare facilities. For adult basic life support, the sequence of steps for the initial assessment and treatment of the unresponsive victim are as below. If the patient is unresponsive with abnormal or absent breathing, it is reasonable for the emergency dispatcher to assume that the patient is in cardiac arrest. Now remember, we have D, R, S, A, B, C, D. Remember this mnemonic because D stands for danger, R is for responsiveness, S, shout for help, A is for airway, B is for breathing, C, circulation, and D is for defibrillation. Now remember that at this point of pandemic COVID-19, it is imperative to wear PPEs, right? Danger. We have to make sure that it is safe to help the victim and at the same time to be safe for ourselves. So the personal protective equipment is to ensure that it is safe for the ones being rescued and also yourself as the rescuer. So what are the PPEs that's important would be N95 respirators, which offer high level of protection, versus face masks when performing aerosol generating procedures. Eye protection such as goggles or face shield, wear gloves, fluid repellent isolation gowns, head cover, and boot cover. Look out for blood spills or electric wires and sharps and surrounding. So for responsiveness, we just tap the shoulders and to ensure that the person is either conscious or unconscious. S is for shout for help, and this is actually to declare emergency and to be able to ask for help and also to ask for a defibrillator. A is for airway, which opens up the airway, and this is done by performing head tilt chin lift. Take note that in trauma cases, we perform jaw thrust. For breathing, we are to assess for normal breathing and look for normal breathing not more than 10 seconds. Start chest compressions if not breathing or there's abdominal breathing is seen. Once we see there's no breathing and no response, we'll start chest compression. Remember that we are to do high quality chest compression. The location would be at the middle of the chest, lower half of the sternum, at the depth of 5 to 6 centimeters, with a rate of 100 to 120 beats per minute. Remember to allow full elastic recoil of the chest after each compression to minimize interruption. Remember that the compressions are 30 compressions to 2 ventilations, where each ventilation is in 1 second. Whenever help has come and defibrillator is available, assess for the need to shock. Attach the AED or manual defibrillator. Do not interrupt chest compression. Follow the AED voice prompt. For manual defibrillator, shock if VF or pulseless VT is recognized and immediately continue CPR. Now I'm going to talk about a terminology for 3 age groups. They include adult, which is after the onset of puberty, children, which is the 1 year to puberty, and infant from the age of 1 month to 12 months. This is the algorithm for pediatric basic life support for healthcare providers. The mnemonics would be same. The only difference would be that for circulation, in less than 10 seconds, we look for signs of life, check for pulse, and start chest compressions if the pulse is less than 60 beats per minute with perfusion. Remember that high quality chest compressions have to be initiated with the 15 chest compressions over 2 ventilations, and each ventilation is in 1 second. Attach the AED for defibrillation. Do not interrupt chest compression. Follow AED voice prompt. For manual defibrillator, remember that the shock energy delivered should be 4 joules per kilo. This is actually the universal choking sign. Because of the obstruction to the airway, the victim will clutch the neck with the thumb and fingers and attempt to cough out the foreign body. Choking can be divided into mild and severe obstruction. So how to know if it's mild obstruction is that when we see the universal sign in adults, and we can ask, are you choking? And the person is able to speak, cough, and breathe. So this would be under the category of mild obstruction. But what about severe obstruction? In severe obstruction, a person will be unable to speak, but they may be able to nod the head. Other signs can be the person will be unable to breathe, there'll be noisy breathing or silent attempts to cough, and subsequently, it'll progress to unconsciousness. This is the adult foreign body airway obstruction algorithm. So we assess the severity, whether it's severe or mild, and as I've said, it's severe, there'll be ineffective cough, whether there's an airway obstruction. And when the person is conscious, we give 5 back blows and 5 abdominal thrusts. Or if there's unconsciousness, we start with CPR. Remember, in mild airway obstruction and a person has an effective cough, we are to encourage the cough and to continue to check for signs of deterioration to ineffective cough or until obstruction is relieved. For pediatrics, it's nearly the same as the adults, where we have the mild and severe airway obstruction. So again, if it's mild airway obstruction, we are to encourage the cough and to continue check for signs of deterioration to ineffective cough or until obstruction is relieved. And for severe airway obstruction, we will see that there's ineffective cough, and we are to give 5 back blows and 5 abdominal thrusts or 5 chest thrusts for infants in those who are conscious, and for those who are unconscious, we start the CPR. The next would be on automated external defibrillators. Now, defibrillators are machines that are capable of delivering DC shock to a patient in cardiac arrest for the purpose of terminating VF and pulseless VT. So, automated external defibrillators are machines that are battery operated, and they automatically read and interpret a victim heart's rhythm and determine whether or not a victim is in need of defibrillation. So these are the examples of AEDs. If you remember just now from the chain of survival, early defibrillation is vital. Why is it so? It's because the chances of survival when a cardiac arrest occurs and CPR applied is 3 to 5%. But the chances for survival with defibrillation is 30 to 70%. So this is actually at the very end of the slide, and this is the summary of the basic life support for adult, children, and infants. The sequence would be to be able to recognize unresponsiveness or signs of cardiac arrest. And the CPR sequence, you have to remember, it is DRS, ABCD for adult, children, and infants. And the compression rate would be 100 to 120 beats per minute. The compression depth differs for adult, children, and infants. For adult, the depth would be 5 centimeters, but not more than 6 centimeters. For children, at least a third the depth of the chest, or until 5 centimeters. And for infants, the depth would be at least 1/3 of the depth of the chest, or 4 centimeters. Now, remember that chest wall recoil is vital to allow complete recoil after each compression. Minimize interruption in chest compression and limit interruption less than 10 seconds. The difference you will see would be the compression ventilation ratio, where for adult is 30 compression to 2 ventilation. For children, you'll see that it's 15 chest compression over 2 ventilation. And also for infants, it's the same, whether it be 1-man CPR or 2-man CPR. Ventilation with advanced airway would need 1 breath every 5 to 6 seconds. And defibrillator is used once AED is available. After this lecture, there'll be demos explaining more about the modules. So I hope that you'll enjoy the course for today, and that's it. Thank you.